As pharmacists, we've introduced a training programme for the nursing home staff, and through that we've managed to reduce prescribing of antibiotics in urinary tract infections by 50%.
So since the pharmacists have come in, we've looked at our residents' symptoms and how they're presenting more. So instead of relying on just a urinary dipstick, we're taking those findings back to the GP, and therefore they're having less antibiotic prescriptions.
As a GP, I've really noticed the benefit of this. And what that's done is to deliver the right patients getting the right treatment. So those people who don't need to have antibiotics not getting them, and those that do need them getting them.
As a community pharmacist, we're here every day. People come in, we're here as the first port of call to treat all their ailments, to try and prevent bacterial resistance. We're there to advise them what is the correct item to use and how to use it.
I find the community pharmacy very useful. It's the first place I visit if I suspect an infection. I'm happy to accept their advice and treatment over the counter.
We give them advice on their prescriptions, how to take their antibiotics. We also provide a flu vaccination service, which is really important to prevent infection and bacterial resistance in the community as a whole.
I'm the antimicrobial pharmacist. The antimicrobial resistance we see now on a daily basis is a huge challenge to us and our patients. Infections that would previously be managed with a simple oral regime now require prolonged admissions with intravenous preparations.
So we work together as a multidisciplinary team, and that would involve myself as a microbiology and ID consultant and my colleagues, as well as the antibiotic pharmacist and also the physicians on the ward. And really on our ward rounds, the antibiotic pharmacist is a key player, so they highlight to us the right dose of a drug, they highlight to us any potential interactions, any side effects often overlooked by actually the prescribing team themselves.
We are running out of licensed preparations to use for these patients. We do need a future pipeline of antimicrobials to use for our patients.
So pharmaceutical science is playing a critical role in developing a response to the emerging threat of antimicrobial resistance right across the globe. Here we're developing the first truly novel class of antibiotics since the mid-1980s. These compounds will treat the most threatening gram-negative infections in hospitals. It's absolutely critical that we develop a new pipeline of antibiotics to give clinicians new medicines to treat patients who face the most threatening infections.